Thank you for joining us for Health Talks. I'm Gail Hogan. A new research grant means experts at the James will help lead an innovative national tobacco study. Dr. Ted Wexner is here to share more. Dr. Wexner, welcome.
Thank you.
What is this new research grant?
So this new research grant is funded by the FDA, the National Cancer Institute, and it's really for us to run research studies to provide evidence to the FDA to help inform the regulation of tobacco products, and specifically e-cigarettes and oral nicotine pouches.
Can you explain what e-cigarettes are and the tobacco pouches?
For sure. E-cigarettes are really a large class of products that have evolved over time, from little devices that looked like cigarettes to big boxy devices, and then eventually now to the devices you see which look like flash drives. Oral nicotine pouches look very similar to moist snuff pouches, but different from those products. They actually don't contain tobacco leaves in the little pouches. Instead, it's nicotine powder mixed with filler and flavorants that people put underneath their upper lip.
What will you be studying with the grant? These two products, what will you be studying regarding the nicotine?
Yeah. In general, with this study, we are going to try to understand, is there a way that we can regulate nicotine in these products, and also the marketing of these products that will make them less appealing and addictive to kids, but still satisfying for adults who are currently smoking and using smokeless tobacco to switch to.
I didn't know that using e-cigarettes was a way to taper people off a cigarette habit. It works?
Yeah, so there has been a recent review done every year by the Cochrane organization, and their latest shows that e-cigarettes with nicotine are actually slightly more effective than FDA-approved nicotine replacement therapy products, pouches, lozenge, and gum, across the trials that they've looked at.
It's interesting that you're studying marketing too, as a medical researcher. Why is that important?
Because it's how tobacco products are first seen by most people, and definitely by kids. And so marketing has a huge effect on manipulating what kids think about products and what adults think about products, but then it's usually their first entree into using the product. And so since our customer at the end of this is really the FDA and providing them the information they need to regulate, FDA regulates the marketing of tobacco products. So that's a key point that we need to touch on, as well as the product itself.
Some of these tobacco-related topics have been studied before. What's different about this one?
What's really different about this is the breadth of what we're covering. So we are going to go from bench all the way to society with this. So we're not only going to look at the product themselves and how the product is being manipulated, specifically the nicotine, which no study has really looked at before, all the facets of nicotine. But then we're going to look at the marketing, and we're going to look at surveillance data to see how people are using this out in the real world and how that can inform our other studies that are done in the lab.
Well, we know that smoking and tobacco affect health.
But sure.
What other surprising things have you found?
Well, I think not only does it affect health, it also may affect other products that people use. So I know that is a concern about a lot of people that, if we use e-cigarettes, will you move on to other products? There is a potential that young people who start with e-cigarettes or oral nicotine pouches might go on to other products. That seems to be a little less often than maybe some people would think, but it's still a possibility and something that occurs and something that we need to work to prevent.
You'll be studying smokeless tobacco. So are e-cigarettes considered vaping? I've heard these terms, kind of confused about them.
Yes, so e-cigarette, when someone says I'm vaping, it means that they're using an e-cigarette. But it may mean they're using an e-cigarette with nicotine or an e-cigarette with marijuana. So typically, for our study, when we're talking about using e-cigarettes or vaping, we're talking about vaping nicotine in an e-cigarette, not vaping marijuana.
What do you hope to find in the end of this study?
I'm hoping that we're able to find how we can manipulate nicotine through regulations. So we can give clear guidance to the FDA and say, if you do X, Y, and Z with nicotine, it will make it unappealing to kids and non-users. but adults who are smoking or using smokeless tobacco are still willing to switch to these products that are unappealing to kids. Also, this is how you should regulate your marketing of the packaging of these products. Include this, don't include this. Hey, make sure that warning label is done this way. Again, to prevent youth use, but also convey accurate information to people who are looking to switch to a less harmful alternative.
So that's what you hope to do. In the end, what do you hope those results will result in as far as patient health?
Oh, I'm hoping that we see a significant decline in not only kids ever using these products, but current smokers and smokeless tobacco users coming off of cigarettes and smokeless tobacco, which we know cause cancer, heart disease, lung disease, head and neck cancers, all the things. We hope that they are able to come off of those products and have a much fuller, happier, healthy life.
So your goal really is healthy people.
For sure.
We're going to switch gears here.
Okay.
The is it called TCORS grant?
Yeah.
It was very competitive. What made your grant application stand out? Why do you think that it was awarded to you?
Yeah, it turns out we actually had one of the highest scores in the nation. And I think the reason for that is a couple of things. I think the infrastructure at the James at Ohio State is amazing and top notch. I truly think our infrastructure is second to no other tobacco center in the country. Two, the number of faculty here that we have that do tobacco regulatory science, which is the exact work that this calls for, made it that if we didn't get it, there was probably something wrong with the writing. So we have the infrastructure, we have the people, and we have a really good idea. And it's something that benefits all of the public. So we didn't want to just zero in on kids or just zero in on adult smokers, but trying to thread that needle. And maybe we won't be able to do it. We think we will, though. Trying to thread that needle to create products that are available for adults to switch to and make a better health choice for them, but also at the same time preventing kids from ever using nicotine. I think that stood out to the reviewers and made a compelling case. We're doing what a lot of people weren't thinking to do, but in all honesty, weren't capable of doing given the resources that we have.
What are the 4 research projects, the core of this?
So the 4 research projects are made up of projects focusing either on the product or the marketing. So projects 1 and 2 are looking at e-cigarettes in project 1 and oral nicotine pouches in project 2. And that's really where we're manipulating nicotine and seeing how people use them and which ones do young people not like, but adults like, and really trying to figure out, look at the health effects of those. And for example, like with the oral pouches, we're looking at how does it affect the oral microbiome? Because we don't really know how it affects it. It's so new that people haven't looked at it. And honestly, it's going to take some time before we know all the outcomes. But if we can look at these early markers or potential signs of cancer, it will be incredibly helpful. So that's what projects 1 and 2 are going to look at. Project 3 is looking at packaging and marketing, and how do we best market these products to make them unappealing to kids, but as I said, still appealing to adults. Project 4 is this large surveillance study. So 2,000 young people, we're going to follow them over 2 years to see what products are they using them, how they're using them, how do the products that they're using predict whether they're going to become addicted or not, or go on to more harmful tobacco products. And we're actually collecting their products from them. So we're paying them to mail us their products so that we can analyze them in our own lab, see what's in them, and maybe figure out why that product led to greater addiction or more harm, with this idea that we're going to try to reverse engineer it to make it less appealing to them.
This is really wide-ranging research. And in the end, what do you think the impact will have when you give this information to the FDA?
Our hope is that the FDA will take this information and write what's called a product standard for these products that says, e-cigarettes, if you want to be sold in the US, you have to meet this product standard, which these studies have shown are not appealing to kids but still appealing to adults. Same thing for oral nicotine pouches, and then same thing for the marketing of these products, making sure that those two have a standard that FDA can write into law and say, this is what you have to meet. If you don't meet it, you don't get to come on the market.
Explain a little bit more about this tobacco-free marketing that they're touting, especially for the pouches, because that can be a bit deceiving.
For sure. And it's deceiving in the sense more that it's misleading. The products do oftentimes not contain tobacco, but they do contain nicotine. And kids, unfortunately, view nicotine and tobacco as synonymous, and actually so do adults. And so the issue with that is, if you say it's tobacco-free, they view it as completely harmless.
Right.
Yeah. Some of them view it as not even addictive. But we know that's not true. And so is there our goal of the study is trying to figure out, is there a way to convey accurately the contents of the product without misleading kids? And we think there are. For example, not putting it in the warning label that this product contains tobacco-free nicotine. Just that this product contains nicotine is all that needs to be said. So there's little things like that that we think we can manipulate that will change perceptions of kids and adult users as well.
As we wrap this up, how long do you think this study will take?
5 years.
Oh, you've already decided? All right.
That's how we're funded for. No. So the study itself will take 5 years. However, there's going to be milestones along the way where we start getting important information that we can disseminate to the community, to the FDA and regulators and public health officials to help them better understand these new products, but then hopefully also regulate these products.
We look forward to what you find. Thanks,
Thank you.
Dr. Wexner. And thank you for joining us for Health Talks.